Hello, my name is Jesse Dickinson. I am going to talk about the different terms we use to define disease. Here is a little flashcard, nothing on the back. And the first term I want to describe is the definition of a disease, and that is any deviation from any deviation of structure or function in the body. In my case, I'm going to use the example of high blood pressure. So it's a blood pressure outside of normal parameters. Next is the disease classification. This can be classified in a lot of ways, but it's based on like what kind of group you might push this in. In this case, hypertension, I'm using chronic hypertension, so it would be a chronic disease. Next, we have the etiology, which is the cause of the disease. In the case of high blood pressure, it can be genetic factors. It can be more than one factor, of course, all at once, but genetic factors, obesity, lack of exercise, poor diet, those can all lead to high blood pressure. Next, we have the pathogenesis of the disease, and this is kind of what happens from the start of the disease, if there is a start, to the as it progresses through the human body. For example, like in high blood pressure, systemic vascular resistance is kind of a silent thing that damages the body. It doesn't. It's not like all of a sudden you may have a bunch of signs and symptoms, but there's that chronic systemic vascular resistance takes a toll on the body in terms of cellular damage, kidney damage, damage to your blood vessels, etc. Next, we have symptoms. Those are subjective complaints such as headache or dizziness. In this case, with high blood pressure, those are things that the patient would report to us that we can't necessarily observe. Next would be signs. Those are objective findings such as high blood pressure. In this case, specifically, a blood pressure above 140/90. And since we're using chronic high blood pressure, over multiple measurements, repeated measurements. Syndrome is our next definition that we want to use, and that is like kind of a collection of different signs and symptoms that tend to be associated with a disease. In my example of high blood pressure, that would be things like insulin resistance, high cholesterol, cardiovascular diseases, and the stiffness of arteries, for example. Next definition we have is diagnosis. That is the ultimate determination of what the disease is. The name we give it, in this case, essential hypertension or primary hypertension, are some examples of ways that we use terms we use to diagnose chronic hypertension. Our next definition is complications, and complications are things that arise from the disease, secondary effects of the disease. Examples of this would be, in high blood pressure, would be things like heart attack, stroke, peripheral vascular disease, kidney disease and failure, heart disease and failure. The prognosis of a disease is the expected course or outcome. That can be in terms of morbidity or mortality. If blood pressure is managed well, the outcome, there's a good prognosis for somebody to still be very healthy. But if it's not managed well, the prognosis is poor in terms of aforementioned heart failure, kidney failure, damage to vessels, strokes, heart attacks, stuff like that. Our last definition is diagnostic tests. These are things we use to quantify the disease further, such as blood pressure readings or arterial pressure readings. In the case of chronic hypertension, this would be repeated readings over 140, roughly 140 systolic over 90 diastolic, over repeated readings over a course of time. And those are for the secondary effects of hypertension. We also can run some lab tests such as kidney function or heart function as well. Thank you for watching my video, and have a good day.